My name's Kayla. I'm a fourth year occupational therapy student.
I'm Zoe, also fourth year occupational therapy student. The whole point of our rural block, it's quite a unique experience, but it's to integrate us into community, help us to understand how OT works in a community setting, and just give us an experience of what we're likely to have in community service years. And it just really stretches us. The goal is to get us out there and to learn as much as we can.
And it's a very unique experience to Wits. Wits is the first that did a rural block for fourth year students, and it really is such a brilliant and much needed block, and we are really grateful that we get the opportunity to do it. So what we did is we were at Skororo Hospital in Limpopo, and we go in, and one of our projects is that we work with the community and help them with problems that they are facing. But we don't just go in and come in and try and do what we think that they need. We do a bottom-up approach. So we use a bottom-up approach in our community-based rehabilitation, which means that we approach the community, we find out what their problems are, what the core roots of that problem is, and then sit with the community and discuss how we can come up with solutions together and what the best solution will be, but it's all driven by the community. And in that way, we're using principles of empowerment, we're empowering the community, we're including the community and including those that are disabled. The people in the community that we are including are those with disabilities, which is really important. And in that way, we're also trying to ensure sustainability.
So in seeing what the community needed, we realized food insecurity was a big problem. So we looked at the issue of gardening, and then part of looking at the previous problems was realizing that gardens had been attempted in the past and there were different problems that arose. You couldn't garden in the ground, it used a lot of water, there were animals eating the food. And so then we sat together and brainstormed and came up with the idea of a vertical garden that we made at this community centre that we were at. And we got the community centre involved, we got them to fetch the resources and them to be involved in creating it. And we made sure they knew that it was their responsibility to keep it up and running, to maintain it, to water it. And so basically what we did is we had water bottle or cool drink bottles that we hung upside down and put plants in, and then the water drips through to the next garden, and that is a more sustainable way of gardening.
The therapeutic aspect of the vertical garden was to using our creativity to find a way to involve the people with disabilities in productive activities, instead of seeing them as people that are disabled and they were sitting in the disability centre all day, not really engaging in meaningful occupations or anything productive. So having the vertical garden is something that they could come every day and they could work on, giving them that productivity, which is a really important therapeutic approach that we identified and that they identified with it. And it was getting the stakeholders involved, the key stakeholders and role players at the Disability Centre involved to help see the vision and help see the importance of having that therapeutic role.
Okay, in South Africa, there's a lot of people with disabilities, and so that's a group we work with a lot. We also really work towards having people engaged in meaningful occupations. And so occupations are the things we need to do, want to do, and have to do in our daily lives. And this needs to be meaningful. Otherwise, there's no real motivation to be doing this. And so we're engaged in making sure people do that. These need to be age appropriate. They need to be appropriate to the part of society you're in. And we need to look at your context and environment as well. Also, we have a lot of rural areas, and I think OT plays a big role in community health and ensuring people know what's available, know what help is there, and just helping them adapt to be able to engage more fully in their lives, essentially.
So if you are someone that's interested in entering the medical profession, but you also have that creative side to you, then occupational therapy is definitely something that you can look into. I really love that it brings both the medical side and your creativity and really allows you to flourish. And something that's really great is that you're working with patients one-on-one, which I really love, and is definitely the reason I went into this. You get a lot of one-on-one time with patients and also able to work with communities. And it really is such an incredible profession and has been very, very fulfilling, and has definitely become my passion. So if those things is something that you might be interested in, then I think occupational therapy could definitely be for you.
It's also a very diverse profession. We don't just work into pediatrics or psychiatric conditions. We work with pretty much anyone. So that's really cool.
Yeah, so we've got physical patients, we've got psychiatric patients, we've got adolescents, children. So it really is a diverse range of people that you're working with and conditions, which is really amazing.